And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna. Today we're talking about a very important subject for people if you've got your kids playing contact sports. So this is going to be your football. This is going to be your soccer. This is going to be your wrestling. This is going to be rugby. This is going to be hockey. This is anything where you have the possibility of experiencing either a concussion, whiplash injury, and even if you don't think that the sport involves contact like this, anything where you've got the possibility of snapping the head like this against either the edge of a pool, so swimming, or against the ground. This is going to include downhill mountain biking, anything like that. This is going to be super important video for you. We're going to get into a little bit of the research, a little bit of the factors that are involved and why it's so important. Number one, if you've had a concussion or an injury like this, to have the health of your neck assessed so that you can allow for a better healing response, but also protect against further injury. But even if you are not actively having symptoms, why it's important to have these things looked at before starting sports to see if you might have a risk factor that makes it more susceptible that you could have some kind of an injury. Now, do forgive me, we can see that this is a little bit more of a casual video. Why? Well, I'm doing this video when we've got the bit of the IT meltdown with the airlines. We're kind of stuck at the moment. Nevertheless, I wanted to get this video out here, so do forgive the casualness here. Nevertheless, very, very important concept. So let's go ahead, jump into it. All right, cervical spine proprioception and vestibular oculomotor function, an observational study comparing young adults with and without a concussion history. Let me just translate a few little terms here first. Cervical spine, we're referring to the neck. Proprioception, these aren't pain receptors. These are the sensors that are in the neck that send your brain information about where and how we're maintaining balance, equilibrium. Very, very important. And as you'll see, and as we'll get into this topic, and I talk about in a lot of other videos, our sense of proprioception. Your brain uses a huge amount of bandwidth that's necessary so that we can be staying upright. And if this particular system is ever damaged or deranged in any way, this can set us up for all kinds of bad things later in life. So vestibular, that's referring to our sense of balance, and then also oculomotor. This is how our eyes move. Why is this? It's because the three major sources of input in terms of balance equilibrium to the brain, this is going to be the eyes, this is the inner ear, and then this is going to be the rest of your body, with the major players being your neck, your jaw, and also your ankles. All the other joints are important, but those are the three biggest players right there. Point is that a disruption in one of them can affect any of the others. So you can sometimes see where a problem with the eyes is going to affect somebody's neck. You're going to see an issue with the neck is going to affect the balance system. You're going to see the balance system affect the eyes. These things play off of each other. Ultimately, what the researchers did is they wanted to see, okay, we've got two groups of kids, 27-year-olds, where they have either a history of concussion or they don't. And we want to assess a few different functions. We want to see, is their balance system working the right way? We want to see, is their neck working the right way? And are their eyes working the right way? So what did they do? We enrolled 42 participants with a concussion history and 46 without. Here we go. Concussion history was associated with a worse HRA. This is head repositioning accuracy. It's also known as a joint or a cervical joint repositioning test. Here's kind of the short of it. You wear a specialized pair of glasses that have a laser right here, and you're standing about a meter or about a yard away from a target like this. And you have a person, as you can see, line up their head so that that laser is going to be pretty much right in the center of that bullseye like that. What you then have them do is close their eyes and then move the head in different ways like this. And you can appreciate how the laser would move. So it's typically done up and down like this. It's done side to side like this. And it's also done with left and right rotation. The left and right rotation is arguably the most sensitive for detecting different balance issues. So what you do is you have a person turn their head to the side like this, and then you say, with your eyes closed, bring it back to what feels center for you. What you would expect in a normal case is that you'd be able to bring the head back into the middle of the bullseye right where you started. But if you are seeing a consistent error like that, it's like, okay, you turn your head and then the brain says, okay, come back to center. Yep, it's back to center. That is a pathognomonic sign something is not working right with the joints in your neck, that there's damage right there. And this means it's affecting the sense of balance equilibrium. So this is what's known as a head reposition test and is one of the most sensitive ways of detecting if you've got problems with brain-body communication, even if you're not experiencing pain or other symptoms. Think of it to a certain degree like cavities. How many times have you gone to the dentist and the dentist says, you've got the onset of a cavity, we have to do a filling or this is going to get worse. But you may say, but doc, I don't have any pain. That is the whole point. Even if we don't have pain in the neck, by assessing our proprioception of the neck, this is how we can detect, prevent, and protect against worse things coming later. So what did they find? Concussion history was associated with a worse head repositioning accuracy, more positive VVE subs test. This stands for visual vestibular exam. In other words, you're doing and you're assessing how the eyes are tracking associated with different balance systems. And this is not going to be working right. Like I said in the very beginning, you can look at the eyes and you can be assessing the balance system as a way of detecting, is the brain and the balance bandwidth communication system working the way that it should be? And they're finding, you're finding more issues when a person's had a history of concussion. No surprise right there. But then also higher DHI scores. This is a questionnaire, dizziness handicap inventory. People are more likely, even as young adults, to be experiencing balance issues, dizziness, vertigo, brain fog, blurry vision, different kinds of things like that when they've had that previous history of concussion. Now, check out some of the conclusions here. Vestibular oculomotor symptom provocation and cervical spine proprioception in parents may persist chronically 3 years after a concussion. So assessing dizziness, vestibular oculomotor, and cervical spine function after concussion may inform patient-specific treatments to ongoing dysfunction. What does that mean in English? I want you to think of, if you've got a teenager or even a young adult, whether you are in charge, whether you're not in charge, that you're wanting to be playing some kind of a contact sport, or something, again, where contact is possible, even if it's not the contact sport we usually think of. Motorbike riding, dirt bike riding, things where you can hit the ground, or even swimming, again, where you can hit the edge of a pool if you're just not paying attention and give a wallop on your head and your neck. You want to assess the proprioceptive system of the neck both before starting the sport to see if you may be at greater risk of experiencing issues, or if you've had an injury or concussion, to find out if something has actually happened. Even if you didn't lose consciousness, even if you're not experiencing pain, point is that if you're testing these systems, you have the ability to see, are you at higher risk by playing this particular sport? If that's the case, you, number one, may want to reconsider that, or number two, you want to make sure that you are doing all of the right things in terms of rehabilitation, in terms of neck function, in terms of motion stability, to make sure that you're stacking the deck in your favor so that you're not going to experience a whiplash or a concussion injury, or at least you reduce the probability of that. And that actually takes me into a little article I came across a couple years ago. I want to hit on that one right here because it ties directly into this. Okay, here it is. This is back from 2022. Poor cervical proprioception is a risk factor for concussion in professional male rugby union players. And something I want to make is a bit of a distinction between a rugby union versus another sport like American football, or even something like ice hockey. In rugby union, you are trained on purpose, don't lead the tackle with your head, because that's where you're going to have the greatest impact. They don't wear helmets. I mean, aside from like a little bit of a leather helmet, sometimes in certain people. So when you're going to make a tackle, it's going to be pretty much head on, and you have to protect your body. Otherwise, guess what? You're going to have almost immediate injury. But think of the nature of a sport like American football. You've got a helmet. So to a certain degree, yes, players are taught these days, don't charge with your head, but you've got this protection here. It's more likely you're going to have these direct kind of impacts. But I also want to contrast this with a sport like hockey. When you get hit in hockey, or another example would be soccer or Australian rules football, when you get tackled or when you get hit, odds are you're going to be hit from either the side or from behind. When that happens, you don't have the ability to brace necessarily for impact. In other words, even though we can be seeing concussion and neck injuries in rugby union players, it's more likely that we can actually have even worse things going on when we would play a sport where we have the possibility of getting hit from behind or from the side and not necessarily see it coming. So nevertheless, what did they do? They did that exact same cervical joint position error test, so that same one with the laser that I showed you just a few moments ago. During the study, they had 45 concussions incurred by 44 players, so 20 concussions per 1,000 played match hours. So it doesn't mean that it happened to absolutely everybody, but still, okay, you're dealing with about a 5% risk right there. There was significant association between right rotation repositioning error and concussion, with a 5% increase in concussion rate for every 10 degrees increase in gross right rotation error. Let me translate that. So firstly, they find is that when people turned their head to the right and they said, okay, bring it back to center, that was the most likely one to be off. Now, I honestly don't know the reason why that would be. My suspicion is because the vast majority of people are right-handed. So that being the case is that right-handed people, it's possible that when they're going to go make a tackle, they have a tendency to do this with their head, and it's more likely they're going to have an injury toward that right rotation side. I don't know if that's the case, but all right, we saw that, again, we're testing the rotational element here. Every 10 degrees that they were off with that reposition error test represented a 5% increased risk of concussion. So what did they conclude? Poor gross rotation repositioning error, it's a modifiable intrinsic risk factor for concussion in professional male rugby players. Interventions to improve proprioceptive function may act as an effective method for reducing concussion incidence in this population. What does that mean? That means that what would work ideally for people before they're going to experience a whiplash or a concussion injury is go to see somebody to have a whiplash or a concussion screening using this cervical or head repositioning test. Go through the neck moments like this to see, is everything working the way that it should be? Because if it is, yes, you can still experience an injury on the field, on the ice, in the water, on the ground, whatever that's going to be. And, you try to be as precautious as you can about this. But if you are already showing signs of dysfunction in your neck, it means you are more likely to experience an injury. And as we know from people who experience whiplash, from experience concussion, the effects are cumulative. That is, you have one injury that may take this much. That's the threshold to start producing problems. Bang. Once you have that injury, this is all it takes to spark another injury. And then another, and then another, and then another. Worst person I'd ever seen, he had 50 concussions cumulatively over the course of his life. He was a rugby player. That's a lot of concussions. And we know some people, because of their genetics, or also, again, because of pre-existing injury, that playing certain kinds of sports, even if they love them, if you want to have a good quality of life, this is not going to be a good idea. But nevertheless, if you see that you are in a risk factor for this, it means that there are things that you can start doing to make sure that your eyes, your balance system, and the joints of your neck are working as good as possible so that it decreases your risk of injury. So this is, again, very, very important. For parents, if you've got your kids who want to play some kind of a sport where there is the possibility for contact, and again, we oftentimes don't think of soccer, swimming, mountain biking as contact sports, but they have a possibility of having some kind of a contact injury there. So it's important for them as well. Have your neck properly assessed in advance of doing the sport to see if there is a risk factor. If that's the case, you can start doing things that are going to protect against that kind of injury. But then especially if you are in a sport where you know there's going to be contact, and if you have had a whiplash or a concussion injury within the last 3 years and maybe even longer, you absolutely want to make sure that you are doing this, because just because you don't have pain or symptoms in that moment does not mean necessarily, as we see with these kinds of tests, that everything is working okay. And if things are not working okay, there is a greater probability that you're going to have another injury at some point in the future, and when it happens, odds are it's going to be worse. So when it comes to protection prevention, what do you do for this? Well, as we had previously stated, you've got those 3 major systems that are involved. Number 1 is have your eyes checked. And this can be done by either a neuro-optometrist, so they're looking to see not just do you need glasses, how's your vision, but how are your eyes actually tracking? Are they moving the way that they should be? So that's that oculomotor side of the equation. Number 2, working with what's known as a vestibular physical therapist. This is somebody who is assessing the different balance systems of the inner ear to see if that integration center is able to process all of this information. Number 3 then is what's known as an upper cervical specific chiropractor. This is my particular area of expertise. It's looking to see, are the joints of the neck moving? Are they functioning? Are they stable in the way that allows for normal brain-to-body communication, function, different kinds of things like that? Because if we've ever had a ligament injury, and like we said, even if it is not going to be creating pain, if it is disrupting the way that your brain is able to process information, and then you have another kind of injury, whether car accident, sports injury, or a repetitive stress kind of injury because you're using one of these all day, every day, or in front of a computer, then you're setting yourself up for future injury. So by having these different systems checked in advance, it can help, the same as you would with the dentist, protect, prevent, but also rehabilitate against the potential of future injury, but also past injury. So thank you guys for watching the video. Do hope that you found it both informative, but also pleasant to listen to, not too boring or anything like that. If you have liked it, please do click that like and subscribe button. Goes a really long way for helping other people find this information. If you've got that friend, family member, neighbor, client, colleague, anybody like that who you think would benefit from watching this video, either because A, they've had an injury and they need to know what to do about it, or B, they want to make sure that their kids and their family members don't have injuries as well, please do share this with them. And if you want more information, you can check out the other videos on my new YouTube channel here. I do a little TikTok channel, or you can also go to my practice website, ClearChiroSpokane.com, where we've got all kinds of blog articles, all kinds of different issues that we see related to the neck, a little bit more about the specific care and treatment that we provide. So thank you guys again. This is Dr. Jeffrey Hanna at Clear Chiropractic Spokane. Get well, live well, stay well.